You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, crowns in a day, same-day crowns. With us, we have an expert on the topic. He lectures internationally on this topic, Dr. Vasquez. Dr. Vasquez, welcome to the program.
Hey, thank you for having me here.
Now, before we get into today's topic, and I know you brought a lot of photos, so we'll get to as many as we can. Who's the typical patient you have, and what are the different procedures that you do? And I guess you've been in San Diego for quite some time.
Yeah, I've been in San Diego for 20 years, but going to the first questions about my practice, I have a general practice here in Oceanside, California. We used to have a practice in Vista, so 4 years ago we moved to this new location.
Okay.
Now, the main thing is I want to build something for my patients that when they cross that door, they're going to feel relaxed, they're going to feel comfortable, they're going to feel welcome.
Okay.
But at the same
because
time,
nobody likes going to the dentist, right?
Nobody. No, actually, I don't like going to the dentist. So if one day I say, if you cannot beat them, just join them. So that's what I did. But one of the other things that we did in our practice when we built this practice, it was bring technology. Today's lifestyle is fast-paced. People use their cell phones to Google everything, to get everything immediate. So realizing and understanding that, I go, if I bring technology to my office so I can offer the best quality, painless, accurate, and affordable same-day dentistry, it will be
affordable same-day dentistry.
Affordable.
Can it really be done the same day?
Of course it can.
When we talked on the phone, not an exaggeration. I mean, there are people that go in, and you could do a crown right there.
Same day.
Okay.
And it's incredible because traditional dentistry it takes 2 weeks, but now with this technology, same day. It takes about an hour and a half, start to finish, with your permanent crown in the mouth.
Are you known for that, by the way? Like when you get referrals, people talk about you behind your back and say, this guy does it fast?
Again, a lot of people, they go online and they start searching. And it's nice when people come to my practice and they said, you do same-day crowns. For me, it's easy because I already know I'm not going to try to sell some technology because they're already coming for that.
Okay, so you're big on digital. Why digital? Because I mean, you like that part of what you do.
Let me tell this story about what happened to me when I used to do traditional dentistry, and even back in dental school. With X-rays is where everything changed in my practice. I got trained this way. We used to have this X-rays that come in a little plastic package. We put it in the mouth. We take the film, and we have to take 18. It's 18 X-rays what it takes for a full set of X-rays.
Okay.
So we have to go to this so-called dark room. I don't know if you remember. It's like old times. So I have to open 18 X-rays, put them in the hanger, and then go and dip them first on the developer, the fixture.
Is that right?
The water, and then I have to wait for them to dry. But then you put them on the red lights to see, and you go, oh my God, I have half of them, they're wrong. I have to retake them. So I have to go back again to the patient, retake these, and do the whole process again.
That's the worst part about the dentist.
Oh, terrible.
It's uncomfortable. Very
uncomfortable. But, technology is moving. So from a dark room, we went to these mechanical, X-ray processors. And, it still take about, 10, 15 minutes. And when you realize, half of your X-rays they're bad. You cannot even see. So about 15 years ago is when I purchased my first X-ray system, digital.
Okay.
So this is so cool because now we put the sensor, we take the X-rays, and immediately it shows on my computer screen.
So it's much faster now.
Oh, yeah. Old times, it was just too time consuming. Now it's not. It's much faster. So that's happening. That's what happened into going into the CAD/CAM world of restorative dentistry. I use CEREC for this.
So you own the machine that makes the teeth.
Yes,
Is that why it's so fast?
It's incredible. It's fast because instead of like traditional, like many dentists still do, the patient comes in, we work on the tooth, we take the impression, the little guffy thing that we put in there, we take it out, we clean it, we mail it to the lab, and it takes 2 weeks to get the crown.
And that's how it's normally done?
That's normally done.
Okay.
During 2 weeks, these patients are wearing this terrible temporary crowns, and most of the times they're always falling apart, it irritates the gum, it's just terrible. So I go, why do this if we have the technology that instead of putting that stuff in their mouth, I just scan the teeth. I just videotape the teeth.
You actually scan the teeth?
We scan
the
teeth.
Like in their mouth?
Oh, yes.
Put a wand in their mouth? Like a camera?
Like a camera.
Okay.
So we put the camera, I scanned. So I'm going to create this model, virtual model. I'm going to design it, okay? Morphological, it's going to be perfect, functional. It's going to be the most perfect crown you ever had in your mouth.
Okay.
Yeah. And just for one click from my computer, it goes to my mill machine. And it's incredible because we have these little blocks that we use to fabricate these crowns. So, and it's like sculpted. We put it on this mill machine, and it's just going to start carving a perfect restoration. See?
Okay. So that's not you in the photo,
No.
right? That little guy. But you take pride in this because we've talked on the phone that you say you compared yourself to Apple Computer. That and I'm paraphrasing slightly, but that the inside of your dentistry looks as good or if not better than the outside. What does that mean?
Well, it means
And what does it mean to the patient also?
it's not only about what we're going to be putting in the outside. A long-term restoration is not based what you see, is what is underneath that restoration. So for me, when my patient come to my office and they're going to trust me, their mouth,
Okay.
because they can't see what I'm doing. They can't. As soon as they go into their mouth, they don't know what I'm doing, so they trust me. So I treat those teeth as delicate as possible and the best as possible, thinking that I'm going to cover that beautiful dentistry that I just did, obviously with this beautiful restoration that today I call them kind of invisible restorations.
Invisible restorations.
Invisible restorations.
Okay. And you also say that you use terms like you mimic or you copy Mother Nature or regular physiology or what's there in nature. What do you mean by that?
Today with cosmetic, for my personal opinion, is aesthetic dentistry. You know, let me show you a case that I have here that I've been very well known for this case. For you or probably for many people, it might not be the perfect, but let me show you this case here.
Okay. What am I looking at here?
See, this patient comes in and said, Dr. Vasquez, I got these crowns. They're too white, and there's a gap in the middle. Food gets in there, and I don't like them because I smile, and they look like they don't belong in there.
Okay.
So this is what we do.
So you mill it right there in your
We mill
machine.
it right there. We put these blocks, we mill it, we scan, we mill them, and then the next thing we're going to do, let me show you this picture. I am going to custom
Okay.
stain that restoration to make it look exactly
match the other teeth.
to match the other teeth.
But these
So-
teeth over here, by the way, they look a little yellow.
Well,
Is that on purpose?
that's on purpose because that's the natural beauty of the patient's smile. And I'm not going to change it with white teeth. That's what she likes, and that's what we delivered.
So what? They didn't want all their friends to know they had work done?
Yes, correct. You know, it's kind of I don't know if you know, you have these patients that always just smiling and then they put their hand over their mouth and you go, why? They smile and you can see these ugly crowns. You really can tell those are crowns. Let me show you this other case that I have in here.
And these are all teeth in a day,
These
kind of
all-
same day crowns.
Same day.
Made on your machine.
Same
okay.
day. I have this other case. Beautiful white teeth. This is a male patient, beautiful white teeth, but this,
So that front right tooth,
he doesn't like it.
okay.
Why? Because he has this big black, aloe around the tooth. So I go, something? I can fix that. Let me do it. We can do it today. An hour and a half. You're out of,
Are they surprised, by the way?
Oh, the wow. They are very wow. Because again, I can mimic Mother Nature. With today's materials that we have, it's incredible. These manufacturers are doing these materials that the translucency that we have, and plus the bonding system that we use when we put everything together, it's like a camouflage. It works like a chameleon effect.
Is there that much to it, by the way? Doesn't the machine do all the work, or no?
No. The machine is just a tool.
I have guys, by the way, and I'm sorry to interrupt, but I mean, look, I interview a lot of dentists on my show, a lot of medical doctors, but I've had doctors tell me, Randy, the problem with machines like this, he goes, I'm not the lab. I'd rather leave it to the experts. I'd rather send it out rather than just trying to give somebody something fast.
Well,
What's your response to that?
I think this technology is not for everybody. You need to like computers. There's doctors they like sending to their labs. Even I have some doctors that say this technology is not even up there like the labs. But
You disagree with that?
I disagree because I do believe that probably 80% of all the labs in the United States they use CAD/CAM technology. Same thing that
Which is what you're using.
Yes. There's cases that I have to send to my fellow lab technicians. But guess what? I don't have to take an impression. I'm still going to scan it. I'm going to scan intraorally.
You put a wand in their
I'm going
mouth
to put the wand, scan.
and make the crown right there.
No, I'm not going to make the crown because sometimes I need a gold crown, and I cannot produce a gold crown in my office.
Okay.
So what I do is I still do the whole process, and I call my friends, I click, I send just an email, and they're going to receive a file over the email, and that is my restoration. They mail it right there, and I get it. If I need it the same day, they will mail it the same day, and they will send it back to my office. Still, might not be the same appointment, but I can promise you that we do same-day dentistry.
But same-day dentistry, is that the future of dentistry?
Yes, it is. It is.
I mean, everybody eventually, dentists will have this in their practice?
Many companies are coming with new technologies, and I do see it 5 years from today, more than 50% of the United States dentists is going to have this technology in their office.
So would you say there's only about 5% of all dentists that even have this?
10%.
About 10% of all dentists?
There's 150,000 dentists in the United States, and it's only 15,000 of us that we have this technology.
I'm going to say something you said to me on the phone. You said, Randy, you can't be a crappy dentist and do this right.
No, you can't.
Elaborate on that. What do you mean? And we're talking about same-day crowns.
Remember that I just told you, I do believe that my dentistry is more beautiful on the inside than outside. Now, this technology requires if I want this technology to work perfect, give good things, you will get back. You will get good things back.
Okay.
You get crappy stuff, and that's what you're gonna get. So no, you need to be a good dentist in order for this technology to work for you.
Okay, good. You brought some photos.
Yes.
And what are we looking at here? These are all the kind of the same-day crown
Same-day
stuff.
crowns. Same-day crowns. See, I'm going to show you this photo here.
Mm-hmm.
What I'm showing in there, it is how we can make Mother Nature and how the material will just blend beautiful on that tooth. Actually, like I said, they are invisible restorations. And it's like it's a new term is going out there right now because that's what we do today. We do.
Do they last longer, by the way?
Oh yes.
If you do it right, then maybe sending it out somewhere.
The older crown that I seen is a gold restoration. I seen 50 years old gold crowns, and they're perfect. And for me, that's the best dental material.
So gold actually lasts longer than anything?
It lasts. But today, with this kind of technology that we use and the bonding system that we use, I am making my dentistry and I'm making my crowns to last like that gold crown that is older than me.
So it doesn't cost more, though, to go to somebody that this is all they do, or this is their focus.
No,
you lecture on the topic.
No, it doesn't. It doesn't cost more. This is just a technology. It's a tool that is going to, is going to help you do faster, accurate restorations. That's it.
What about sedation? You say you do sedation.
Oh, I love sedation. Why? Because there's many patients that really fear going to the dentist. They do fear. I'm one of them. But I have learned to live with my fears because I'm a dentist. But many patients do really fear the dentist. But now we have these techniques that we can sedate a patient, and we can do all dentistry. And because we have this technology, we can do it right in the spot the same day. They don't have to come back. So it just works perfect. The sedation and same-day dentistry, it just works perfect.
Are you faster than most dentists?
Well, I seen dentists.
I mean, what do you think? Are you?
I'm pretty fast. Yes, I am. I'm a fast dentist.
And quality, though. I mean, you would put your quality against anyone.
My quality dentistry that is given in my practice, I can put it in big pictures and show it in front of 5,000 dentists with absolutely no problem or be afraid about the quality dentistry that we deliver in my practice.
I recently am sending somebody to you, and I visited your office.
Thank you.
Thank you
for the referral.
I got a tour, and I thought I was just getting the VIP treatment, but you say everybody gets that.
Everybody gets it. It's like when somebody comes and invites you, to their home and they say hi and they sit you right in the corner and that's it, okay? How do you feel? But it feels different when somebody invites you to their home and they feel so honored that you're there. They're going to show you the whole thing they have. I think I use the same knowledge in my practice. Why get a patient, sit them in the chair, and forget about them? Instead of, we bring our patients to our practice. We are waiting for them. We know they're new patients, and we're waiting for them.
Okay.
And we're going to go and share everything that we have, all the technology, everything that we show, what we call my wall of fame with where I have all my diplomas.
I saw that. That's a lot of
my,
diplomas, by the way.
And my staff diplomas, because not only me, all my staff gets their own diplomas too.
Okay, that makes sense.
Okay. And the main reason we do this is because I want my patients to know that we always getting educated, learning the new techniques. They're going to get the best quality dentistry. And we show also all the technology that we have. They might not need it, but guess what? If they're happy with my services and one day they're sitting at a table and somebody breaks a teeth, they can say, go to my dentist, Dr. Vasquez, he can fix it right now.
He's good.
He's good.
Same day. Do you ever get emergencies like that?
We do get emergency.
Where people have a cracked tooth and...
My best patients ever.
Really?
Yes, because they come, they're expecting not to get nothing done. And you know something? Yes, we can do it today. Just give me the okay and we'll start working. They're not even numb and we already start scanning their teeth.
Even if it's a front tooth, same day crown on the front tooth, isn't that trickier?
It is not tricky when you don't understand aesthetics, but now that we have all these materials are great.
So front tooth with this machine.
Front tooth.
And you don't send it out to the lab most of the time.
I can nail it. I did show a picture where I'm showing a front tooth. Can you tell the difference in it?
Interesting. Is that what it's made of? Porcelain
all ceramic
veneer,
yes.
But you made it right there.
Yes, correct.
Interesting.
It's beautiful. Yes, we can nail it.
Because I thought that machine is more of just a flat, white, more so for the back teeth.
No.
Is that the perception or no? Or maybe just something I thought?
That was about, let's say, 8 years from today. Okay. Today, all these new materials that we have, the way, before they used to be just monochromatic, meaning just one color, and today we have polychromatic. There are multiple colors already. So we can mimic the Mother Nature.
Okay, so you love this technology. Also, cone beam. You have a CT in your practice.
CT scan. One of the best diagnostic tools in my practice. Why? Because before we only take an X-ray and I only see it in one way. But today I take a 3D scan and I can see three-dimensional. I have some patients that come with pain and we don't know where it's coming from. Next thing, take me a cone beam. And we know exactly where's the problem. But it gets even better.
Okay.
Because now, with this technology, we can trim implant single implants in one appointment. Utilizing the integration of both technologies, the CEREC and the cone beam. I can design the crown in my CEREC, integrate it into my X-ray, put the implants in the middle. I'm going to produce a surgical stent in my office in 30 minutes, where I'm going to be placing that implant in the most accurate position. And I can restore the same day because I have a file. I can put a crown on top of that tooth. So you don't have to be walking without a tooth. You're always going to have a...
So same day crowns.
It's
not an exaggeration, you say.
Same day implant, same day crown.
Okay, now you brought other photos. What are we looking at?
Yes.
And these are same day people.
Yeah,
same day crowns.
Same day crown. This is a nice case. He came to the practice at Dr. Vasquez. My girlfriend doesn't like my teeth.
Okay.
I go, really? Because I don't like him either. And I go, is that a Playboy we have you in front of? And I go, yes, that's a Playboy. You know something? We need to get rid of that. What do you think? It's kind of like a bunny. So I just call it a Playboy.
Okay.
So he asked me, I need to get rid of these. I go, well, let's do it. When? Today. Your girlfriend doesn't like them, correct? Let's make her happy. Let's do it today.
You say this to the patient right there?
Of course.
Let's make her happy. Let's do it right now.
Let's do it right now. Happy wife, happy life, man. So
okay.
I go by that philosophy. So why not have a girlfriend happy?
Okay.
So that day, same day, took off these gold restorations and placed these beautiful, beautiful restorations.
Yeah. Very nice. Very nice. And those will last a long time.
I want them to last a lifetime. Normally restorations will be permanent, but these restorations, I want them to last. Actually, I want to retire and be done, and I want these restorations to be there.
Are you a perfectionist?
Very perfectionist. Let me show you a couple cases. This is a case of a patient has a porcelain middle crown.
Okay.
The ceramic chip away, and then she has all this metal showing up. And she goes, Dr. Vasquez, I thought this was just all porcelain. I go, no, this is still traditional dentistry. Let's change it. Let's make it just disappear. So what we do, same appointment, get the old crown off and put the new one in. Let me show you another case. This is beautiful old metal crowns. Patient doesn't want to get rid of all the metal from her mouth, so that's what we do.
Okay, and this is just milled on your machine, made right there, same day.
Now, this last one, it gets even better because the crown is beautiful. You know, it's just metal. It's a metal crown, but it's a beautiful crown. Patients already, her brain set on the bite and the occlusion is perfect. So with this technology, it gets even better because I can copy and paste. I'm just going to produce the same restoration, but
just white.
It's just going to be white because I'm just going to copy it. That's the beauty about computers today. This other case, old amalgams, same thing.
So is this your favorite kind of teeth in a day kind of thing? People walking around and they have metal showing in their mouth?
Let's get rid
or a
of
chipped front tooth, just go in, same day.
They come in for something else, and if they have a tooth in the front that I don't like it, I just tell them, you know, do you like your tooth in the front? And they go, no, I can fix it. Let me know. I'm ready for you.
Are there a lot of people like that, by the way?
Oh, man.
Here in San Diego?
A lot of people.
Like, do you see them? You see them walking around, and you say, boy, I could...
I would like to extend my business card and say, there you go. Whenever you need to get that tooth out of your mouth, let me know.
Have you ever done that?
Not yet, but I would like to do that.
Yeah.
You know,
but you're dying to do it.
I get nervous when I see that. I would like to approach somebody, but I go, no. But I think one day I'm going to do it, Randy.
Yeah, I don't think it'll be that offensive to do that, to see you do that. Now, I asked you on the phone. You said, Randy, it was something about teeth. You said, I'm not changing teeth or fixing teeth. You said, I'm changing lives. Elaborate on that. Because I think you believe that.
Yes, I do believe it because it's just not, you know, the way they look. When I see somebody, it just, this is what I tell my staff because it's all my staff because I have my associate doctors in there and my staff. I always tell them, I like to create emotions.
Okay.
You know, and the emotion to change somebody's life. Give them that smile they always wanted. Or if they have this ugly smile, let me show you this picture.
Okay.
You know, I call this.
Oh my goodness.
I call this the gambler. You know, for so many years he had this, you know, those front teeth. You know, in some countries, this is kind of like it gives you a status when you do this kind of restorations. But here in the States, it doesn't. You know, you need to get rid of them. Yeah. So he came one time to my office and said, Dr. Vasquez, and I was like, can you fix this? And I go, can I? Of course, I will fix it. Let me do it. And actually, we finished this case a week ago. And that guy was so happy that he's right now on vacation with his whole family in Mexico, bragging about his teeth. Yeah, well, yes. And we, again, it's not only we change, you know, people's smiles. I think we change people's lives.
Do they travel to see you? And do you ever help other dentists with their teeth?
Yes. Actually, the dentist that got me into this technology is a good mentor, a friend of mine. I have to cut a tooth for him. And I have some friends that come say, Daniel, you know, it's like, can you do my teeth? And I go, of course. I do a lot of dentist friends that come.
So you teach these crowns in a day to other dentists. What's the toughest thing to teach?
Many of them still do not believe that this technology can do everything.
Like it's not there yet.
It's not there yet.
Because, you know, going into this interview, I thought, you know, because I've seen some of these machines, and at least this is what other doctors tell me. They say, Randy, it's not good for the front teeth. And you say it's not true.
It's the most beautiful
Like if they don't know what they're doing, or they don't know how to maximize the use of the machine,
I teach them
what's the polite thing to say?
I teach them. I help them to maximize. They have to believe it. But everything is in your hands. It depends how artistic you are. If you're an artistic guy, trust me, you're not going to be scared to be working in the front teeth. Because I am a very big guy. So if I'm going to deliver a smile, I'm the first one to be convinced that it looks beautiful. If it's not beautiful, I'm not even going to get the mirror to show my patients because I am not happy. Because I know that I'm not going to transmit that to the patient. But if I'm happy and I have this big smile, this big white smile, okay? And I show that to my patient. You know something? When they get the mirror, you know, I can see sometimes, even on my men patients, tears coming out. And it's why I go like this.
Wow.
You know, it's not just the smile. It's the emotion that it creates. And the whole office get emotional too.
Okay, good. Final message. Somebody that wants to get things done in a hurry, okay, but they want great work. What do you say to them? And they're afraid of the dentist, right? Nobody wants to go to the dentist.
They're afraid, and time and money. You know, that's what everything comes together. If you're a patient and you really have this anxiety going to the dentist and you don't like your smile, we have techniques that we can help you. We can minimize those moments at the dental practice that you're not even going to remember that you were there. That's one. We can use conscious sedation. When it comes to money, you know, a lot of people say it's very costly. To be honest, how do you know if you don't know how much it's going to cost? So come to the practice.
Okay.
Let me talk to you. Let me explain everything, the whole process, and I'll give you a fee. And then you can say it can be expensive or it can be affordable. We never know. And the time. Because I can do it in one appointment. You don't have to be missing many days out of work. We can do everything.
Same day.
We can know everything in the same appointment.
What if their mouth is a mess? Some people still same day?
I try to. And more if I have to do massive dentistry, then I recommend get the patient sedated, and so I can have 3, 4, 5 hours just to work in their mouth in same appointment.
Okay, good. I want to thank you for coming to the show. Very interesting. They can visit your website, find out more.
They can go and visit my website. Is VasquezDDS.com.
Okay.
And they can get all the information. Actually, they can make an appointment directly from there.
Okay, crowns in a day. It's real. It's happening right here in San Diego.
Oh, I don't think you believe it, but now I see your smile.
I believe it now. So,
by the way, do you need a crown?
if I do, I'm going to you. How's that? Same day.
That's the deal,
Same day. All right, thanks again. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com and just put in Dr. Vasquez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.